we are glad that, notwithstanding traffic jams and bad weather, you are today together with us, and you participate in our meeting in which we are going to discuss the results of the public discussion of the educational and medical reforms. My name is Iryna Borzylo, and we would like to discuss in a very succinct manner the demands of the Ukrainian public towards the reforms of education and healthcare systems. Until December, we've been touring all over Ukraine, visiting many regions of Ukraine, and we have dozens of contacts with the activists, with the representatives of the local authorities, local medical and educational establishments, in order to gather information that is needed to make the reform of the healthcare system and educational system constructive and beneficial. Special attention was given to the accounting of the medical authorities, of the educational authorities, as well as local authorities operating in this in these realms. The first stage of the tour, I might remind you, during that first stage, we have visited, or rather, we visited 63 cities and towns, all the regional centers. And in all the regional centers where we staged public discussions, we might say that all members of the communities, local communities who are actively involved in medical and health care issues, they took part in these discussions. Some of the towns were visited even twice, and in our agenda, we have covered the whole number of issues. When I say us, I mean us, our organization, ZminyTy, sorry, and also the representatives of the Ministry of Health and Ministry of Education. So it was, so to say, a reform unit, we can say. A big group of people, team, who is involved in preparing and executing the reforms, so that the government will be assisted by the opinions, by the comments, by the views of the public, and thus being able to make these reforms constructive, so that the dialogue between the public and the government would help to make these changes, these reforms, more qualitative. Also, when we were visiting the regions, we discussed specifically such issues as the mode of making these changes. Sectoral reforms were also in the focus of our attention. Specifically, we discussed the implementation of the healthcare system. What is this reform of specialized and highly specialized medical assistance envisages, and what model would be the best for Ukraine? As I have already told you, during the first stage of the tour, there was the first stage of the tour, during which we specifically focused on the primary medical assistance, and also primary segment of the educational system and how to reform them, those primary stages of healthcare and educational systems. We have also discussed the ways of best possible control of the expenditures, public expenditures. How are that money expended, used, how they are spent, and what is the control system that accounts for the efficiency of these expenditures. So the tour covered or was employed, so to say, the policy cycle, full policy cycle method. That is the way that is used in Canada, in many other countries, of how to prepare the reforms, and that's what we suggested that Ukrainian government follow in order to make the most efficient reforms. And the partners of during our tour, they also have an opportunity to test, so to say, this full policy cycle by visiting the regions and trying and developing the best possible policies. So the consultations with all stakeholders, as they say now, then the consultations then the development of drafting of the so-called Green Book, enumerating, listing the problems that need to be tackled during these reforms, and so on. Who in the regions were the participants of this political cycle? Professional educators, then the activists, the experts, just the conscientious citizens. Among the medical community were the medical doctors and representatives of medical professions, as well as the journalists, the students, for example, the active representatives of small and medium businesses, who might be or are already involved in these areas. So in 4 months, we organized around 60 events on these two topics of medical reform and or healthcare reform, healthcare system reform and educational system reform. And also we visited all 23 regions, administrative regions, the so-called oblasts of Ukraine, and more than 3,500 people took part in those events. Let me now turn the floor over to Mr. Oleksandr Yabchanka, who is who represents the coalition of reanimational reforms, so that he can summarize, so to say, give us a summary of the opinions, of the comments that were expressed during that tour, specifically with regard to the healthcare system reform. So the floor is yours, Oleksandr. Please go ahead. Thank you, Iryna. Thank you, ladies and gentlemen, for your participation in this meeting, at which we would like to discuss the results of a tour that I hope becomes traditional. And let me start with stating that a lot of people expected, already were waiting for us in the regions, because during the first tour, many of the people were just surprised to hear from us those questions. What do you expect from a healthcare system reform, and so on. So this time, those who took part in the first consultations that we conducted during the first tour, they this time were already ready. They have they prepared their replies and opinions and comments, especially in Lvov. It was we felt that there was a great deal of attention and readiness to our visit and to these consultations. The very positive factor was that people were pleased to feel that their opinions are an object of interest, that somebody is asking their opinion on this or the other matter. So what were the main clusters, so to say, of the discussions? First, we asked about the opinions about the financing, the ways of best ways, most efficient ways of financing of primary medical assistance. The questions we were asked were about the accreditation, the licensing, so to say, of the medical specialists, and we came to the conclusion that this licensing procedure made a little bit more difficult this stage of the primary assistance reform. The other topical issue, very acute issue, was how the price of this or the other medical service is going to be calculated. We found that it was very difficult, that even for the local authorities it was very difficult to resolve this issue. So we even pointed this problem out here, the difficulty for the local authorities to come to the agreement among themselves in a medical precinct or medical district or whatever name we use. And how can we achieve better quality of medical services with the rather obsolete medical infrastructure that is now in place all over Ukraine? What were the proposals? I would like to point out right away that a lot of financial means that are now used, a lot of funds that are now employed in the healthcare system are the so-called gray funds, so to say, because there is a lot of informal payments required by medical specialists, not much of direct public or national budget financing or local authorities budgets financing. So a lot of medical specialists expressed their wish, their desire to be allowed by the ministry, by the government, to have these additional, so to say, ways of earning money, increasing their incomes to at least some decent level of income. So, and for many of them, from many of them we heard the request to at least somehow fix in some law the need to raise the salaries of the medical specialists in Ukraine to some more or less dignified level. The next issue was the, so to say, protocols, the algorithms of calculating the cost and the prices, rather, of medical services. So that there will be some unified, more or less comprehensible system when the local authorities and the medical specialists, medical authorities, they all agree among themselves on the needed level of pricing of medical services. And then also was the request of that the government issue some comprehensible documents, guidelines, so to say, for this medical reform, of what needs to be changed and how it should be changed. The expectations from the Ministry of Health were that the medical specialists appreciated the effect of being consulted by various authorities. Also, the local authorities were pleased that there was a great deal of attention towards them on those issues of medical reform. And the next issue was the financing of all the other segments of healthcare system. The primary assistance, yes, it's more or less discussed, more or less clear, but specialized and highly specialized medical assistance, how it's going to be reorganized and how their services, or the specialists rendering these services, how these services would be priced. The requests to these services, and then also the very topical issue of the supplies of the medicines and the prices of medicines. It's a matter of interest of both the medical specialists and the patients themselves. again, including the medical supplies needed for specialized and highly specialized segments of healthcare system. And also one more matter that has probably never been a focus of any medical reform efforts. It's also the development of so to say, the interaction between various professional parts of the healthcare system. Like, for example, the psychiatry, what's their role? It has never been discussed before and reformed before. Again, let me emphasize that it was a great, big plus, so to say, a very positive development for us, for the medical doctors, that we were consulted for the first time by the government on our views of the possible outcomes, results, and the ways of implementing medical healthcare system reform. Well, we have a more detailed report on our visit. It's a voluminous, rather large book. We are trying to publish it by the end of next week, and we would like also to convey it to the Ministry of Health, because the real purpose of those consultations and of that whole tour of Ukraine was to provide the ministry with better understanding of where the gaps are in the healthcare system, what needs to be done. And so we really appreciate the Ministry of Health for their reaction, positive reaction towards our initiative. And the acting Minister of Health of Ukraine, Ms. Ulana Suprun, in particular, we would like to thank her. And let me now turn the floor over to her so that she could also express her opinion, her views on that tour and on those results. Well, let me try to also pack, so to say, my information in a few minutes, because as was already said, it was the second tour of in which the specialists, the experts of the Ministry of Health took part. The first one was mostly organized by, and the participants were mostly the non-governmental organizations, but I accompanied, took part in some parts of both tours. We contacted the stakeholders, trying to develop a concept of medical reform and to see whether what we thought of and the experts in Kiev were inventing, so to say, in Kiev, were they valid also in the regions. Because sometimes we faced the situations when in Kiev the experts presented one set of views, but in the regions these views were not shared at all by the locals, so to say. So we tried to consult as many people as possible, including the local specialists, medical specialists who work directly at hospitals, at different medical authorities, at different levels, at the local level, regional level, and also the international expert community, so that we can gather the whole possible array of views and comments, and to get feedback, as much feedback as we could. And I must say that that first tour, for example, it affected greatly our views on the concept, and it brought about some changes to the concept. To name just a few things that were changed, there was, as you know, a law on medical services adopted recently, and we asked, for example, medical specialists, would they agree to a 10% co-financing, so to say, for their to be obtained directly from the patients. Would the medical specialists agree? We felt that the citizens of Ukraine were capable of paying 10%, so to say, surcharge to the official price of that or the other medical service. The second aspect was family doctors, so to say. And the family doctors, there were no pediatricians, and the medical doctors, with regard to the family doctors, we heard the opinions of especially young parents that they would prefer the specialized pediatricians, specialized doctors for the children. And so we decided to include the pediatricians to the primary assistance segment of of healthcare system. During the second tour, it was even more interesting because it was not only me or Mr. Kovtanyuk who is directly in charge of the reform. Our bureaucrats, so to say, from the ministry, they also toured the regions. They changed, they came back completely changed people. And they can now see it better, that can now have better understanding of how their words, how their views are reflected, so to say, or executed or not in the regions. So they now understand that their decisions in the ministry, they have rather strong bearing on the lives of rank-and-file Ukrainians. How, for example, the role of a medical pediatrician would help in, taking better medical care of the children. In the second tour, there were also the situations when our team visited a town. The members of the team took the feedback from different specialists, and we also used that information to alter, to change the decrees of the Ministry of Health. We improved them. So my opinion now is that we need to listen to the people. We just need to listen to their comments, to their opinions, to make a dialogue, so to say, that was lacking, frankly speaking, in Ukraine. The dialogue between the government and the rank-and-file citizens, with the participation of various stakeholders, public servants, and so to say, their intermediaries at the local level, because in the local administrations, in the local among the local authorities, what we send them from Kiev, it changes significantly until it reaches the local level. So our view now is that we as the ministry need to produce, so to say, the framework documents and make the very general guidelines, because as you understand, in Odessa they have different requirements and needs than in Transcarpathian Oblast and so on. Are we going to cooperate further on with your NGO? I hope so. I would like to stay in Kiev, to take part in that. So we all stay in Kiev until January the 15th, and then I think it would be worthwhile to make another tour. On that law that I have mentioned, the drafting of that law was completed, or redrafting rather, and as soon as it is redrafted, I think we can proceed with its enactment. We also developed what we call a workbook for the doctors, so that they better understand of how they need to work now. And we would like to check also the provisions, so to say, the clauses or the things that we put in that workbook. So then the primary segment of the healthcare system, as we have mentioned, the changes there, the reform there should be completed by the end of next year, so that the new way of financing of their services would materialize. So we need to make it, to put all these things with financing and payments in order. So we hope, I hope that it would be good to have another trip for the implementation and of these changes of that reform. And all our members of the ministry, starting from me as an acting minister and down to the sectoral specialists and experts, they need to go more often into the regions and to see with their own eyes what the situation is in the local hospital, in the local primary healthcare units and various hospitals and medical establishments. It's very important because that's the way that is the way of improving the motivation, so to say, of medical specialists. How can they provide better services of better quality and have a dignified salary for that? Well, the law on the medical reform has not yet been signed by the president, and it's now more than 2 months. As we know that the educational reform law, for example, was signed much quicker, although there has been there was a great deal of controversy around that law, but still we cannot start implementing the reform without the president officially signing it, so that that law on the reform be enacted. And I call on the president to sign that bill into a real act of legislation, and we feel that the whole work is stalled, so to say, unless until that law is signed and enacted. There is also a draft law on the medical on the healthcare system in the rural areas. We cannot finalize that without the president's signing the first bill. Well, thank you. We were planning to discuss 2 sectoral reforms today. Not only the medical reform, but also the educational system reform. But unfortunately, Ms. Iryna Kohut, who is a leading expert, and also the other representatives of the ministry, they couldn't come because of their work in the ministry. So, unfortunately, regrettably, we cannot discuss the educational reform today, but we are planning to reschedule this discussion for January. So now we have some time for questions and answers and for the discussion on this very important matter of medical reform, healthcare system reform. During our tour, we felt a great deal of demand at a local level from the local specialists on the changes in the healthcare system. So before we start this questions and answers session, let me turn the floor over to Ms. Astrid Kohl, who is a representative of the ULID mission in Ukraine. Ms. Kohl will also contribute to our discussion on how to implement better the reform at a local and regional level.
Pleasure and actually a great honor for me to present or to address you here on behalf of ULEAD, the Ukraine Local Empowerment, Accountability and Development Program, which is, as you might know, a multi-donor action of the European Union and its member states, Denmark, Estonia, Germany, Poland and Sweden. I am very glad, that we came to this point now when we have the final results of the consultation tour, because as ULEAD, we certainly share the understanding that you cannot have a reform without communications. In other words, you need communications to make a reform a success story. And as you said, Honorable Minister, it is actually, you need the communication within the whole policy cycle when it comes to the decision-making process, when it comes to the implementation of the reforms, and also when it comes to the aspect of monitoring and evaluation, and the need of maybe adapting something, to the actual needs. As ULEAD, we are providing support to the government of Ukraine in terms of the decentralization reform and also the sector decentralization reforms, meaning the healthcare reform and the education. And our aim is a way to contribute to the establishment of a multi-level governance that is both transparent and accountable, but also responsive to the needs of the citizens. And then we come to the communications and to the dialogue aspect, because it's not just about providing information, but it's also about, how you said it, entering into a dialogue of getting all stakeholders involved at the table, get their voices heard, listen to them, and whenever possible and considered necessary, to include and consider these opinions in the policy-making process. And therefore, I'm very happy, and I guess this is the most successful factor, actually, of the tour, that the results of the consultations that Center UA provided with the support of ULEAD is actually feeded in the policy-making process of the line ministries, of the sector ministries. And therefore, I would actually like to express my appreciation also for the efforts you did. And I would wish the ministries all the best, for their future work in implementing the reforms. And certainly, we also will have the chance, together with you, you know about that, to see how we can structure our future cooperation, what your needs are, how we can respond to it, and we will be happy to provide you any support that makes these reforms a further success. Thank you very much.
Thank you. Я б хотіла запросити, можливо, наших спікерів присісти для сесії.
I would like to invite the participants to the stage so that they would be, so to say, the panelists to whom the audience might put their questions. Do you have a question? Please go ahead. Can we have a microphone? Here you are. Dear colleagues, do you have any questions on the problems, on maybe some aspects of the healthcare system reform that are not well understood yet by you as the representatives of the public or the media? I have a question directed more probably to Ms. Yabchanka. If we speak about this need of better explaining the medical reform, the healthcare reform, specifically, for example, the need to eliminate the risks of corruption when the funds allocated for medical for medical institutions functioning is allocated, is disbursed. We are trying in our among our experts and colleagues to better understand how it's all organized. Well, I would start with saying what are the people who can be, so to say, the drivers of the changes that might affect and might disrupt the already well-entrenched corruption schemes. I would say, I'd like to say that there are the key stakeholders on whom the implementation of the healthcare system reform depends. These are the local authorities, these are the practical doctors, the government, the patients. And so if all these stakeholders do what is required from them, what is needed, then the healthcare system reform would be a success. And it will be done in a transparent manner so that the journalists and the law enforcement agencies could easily verify every stage of implementation of these reforms. But I am of the opinion that it's all going to be impossible without the NGOs. The NGOs, in order to work efficiently, more efficiently, they need to have certain knowledge, amount of knowledge, body of knowledge, so to say, related to healthcare system reform. So they need to be, all the stakeholders need to be informed, and they all need to be provided with appropriate instruments, so to say, in order for them to assist in this process of the implementation of healthcare system reform. For example, the stage of autonomization of the local medical institutions in the various segments, to make them more, so to say, independent and more efficient. So this is as an example. We hope that you will assist us, you will help us as the media with your information capacity, so to say. We, from our side, we can organize masterclasses, so to say, seminars. I would like to add that last year the Renaissance Foundation helped us greatly. 50 activists from various regions were invited, and the representatives from Transparency International and the representatives from the Anti-Corruption Center NGO, they were all invited, and they had a seminar. They were taught on how to work, what would be the best way for them to counter, so to say, to struggle against corruption, how they should, for example, contact the police and the other law enforcement agencies of Ukraine. And so such seminars are very interesting and useful, and they help local specialists to better understand their abilities, to improve their abilities, so that they understand not only what they can do, but also how they can do it. And there were a lot of questions during those seminars about various aspects of that work. So we can organize another seminar like that and discuss these issues and explain them to the NGOs activists. Well, thank you very much for your participation in this discussion. And as I have already informed you, there are two reports, detailed reports, one on the healthcare system reform and the other one on the educational system reform. We are planning to publish them by the end of this year. So in January they will hopefully be available. And the idea is, so to say, to inform the public on what we heard in the regions, touring the regions, and discussing these reforms. Thank you.